So, what happens to the fetal circulation at birth, or the changes that happens at birth and after birth? As we have discussed in the previous video, there are shunts which are unique to the fetal circulation. We'll just come to it once again. So, there is the ductus venosus which connects the umbilical vein to the inferior vena cava. There is a foramen ovale which opens from the right atrium to the left atrium, and there is the ductus arteriosus which connects the pulmonary artery to the descending aorta. At birth, when the baby takes the first breath, the lungs expand. The alveoli inside the lungs, they expand. The fluid is absorbed by the lymphatics. Secondly, when the placental circulation is cut, there is a sudden fall in the blood that is reaching the fetus, as a result of which more blood volume is to be accommodated by the fetal, that is the baby's body, so the systemic vascular resistance increases. Here, as a result of these changes, the pulmonary vascular resistance decreases. Second thing what happens is, there is an increase in adrenaline and noradrenaline inside the fetal blood. This increase is secondary to changes in ambient temperature, in the alternation in blood gases at birth, cord clamping, and increased blood volume and raised intracranial pressure. So, this epinephrine will maintain increased cardiac output and myocardial contractility. So, net result of all these changes is systemic vascular resistance increases and pulmonary vascular resistance falls. Umbilical blood flow decreases to less than 20% initially, and as a result of which diameter of both the umbilical vein and the umbilical artery decreases. Ductus venosus functionally closes minutes after birth, and anatomical obliteration occurs by 2 weeks. So, the umbilical veins and the umbilical arteries are cut here, they are obliterated. Then comes the ductus venosus, no more blood flows through this, it functionally and then anatomically closes. Now the third structure is the foramen ovale. The foramen ovale is so positioned that the flap on this side is longer and this side is shorter. So the blood flows from the right atrium to the left atrium. So once the pressure on the left side of the heart increases, what happens is this flap comes and closes so that the blood can no more flow from the right atrium to the left atrium. Functional closure of this occurs in 30 minutes after birth. Again, when the systemic vascular resistance increases and the pulmonary vascular resistance falls, what happens is the blood from the right ventricle flows through the pulmonary arteries into the lungs. So it will not pass through the structure called the ductus arteriosus. So within 15 hours of time, the ductus arteriosus functionally closes, and anatomically it closes by 2 to 3 months of age. So all the the first shunt, second shunt and the third shunt are closed, and there is no more of flow of blood from the mother to the fetus. So what happens to these structures? The umbilical arteries, they become the median umbilical ligaments. The umbilical vein becomes the ligamentum teres. The foramen ovale is closed and it becomes fossa ovalis. Ductus arteriosus becomes ligamentum arteriosum. Ductus venosus becomes ligamentum venosus. So these are the structures which remain in the adult circulation as remnants of the fetal circulation. So once all these structures are gone, the blood starts flowing again in a serial circuit, that is from the right atrium to right ventricle, then to the lungs and back to the left atrium and the left ventricle. So that is how the fetal circulation gets changed into adult circulation.